Hi, my name is Leah Lynch, and this is my capstone intervention presentation and reflection video. Throughout my RN to BSN journey, my family have been my greatest supporters. So it made sense for me to create something that would support them individually and adults at every age and stage of the healthcare journey. Sometimes getting started is the hardest part because it's scary. And there are a lot of unknowns about your individual health. There are so many choices to make when it comes to choosing a provider, establishing a treatment plan, and your team, and getting the right services in place. It can be so intimidating that people like my husband and my sister's family choose to delay looking for care until an emergency happens and the choice has to be made for them. Being in person with my family over the holidays provided the opportunity to present my capstone project to them, which is an educational brochure that details how to get started finding a provider, describes the treatment team and the important players in care coordination, as well as many resources that may be available to support them in their community, like support groups and transportation. On Thursday, November 25th, 2021, I met with my dad, Steve Broich, and shared my intervention with him. My dad is retired, and in his life, he studied biology. He was part of a medical platoon in the Army, and as a civilian, he became an industrial hygienist. So, did a lot with health and teaching, educating. My father has an established treatment plan for his chronic conditions, but has struggled with the communication and care coordination between his providers and pharmacies and care partners. When describing the care coordination that an interdisciplinary team could provide, he became enthusiastic and appeared empowered to ask for more collaboration within his team. He could identify the benefits of a nurse case manager or navigator after going through the brochure, and that with greater advocacy, it might make coordinating his chronic health needs easier. In looking over the brochure, he commented that he really did like the content. It was very well organized. However, he noted several grammatical errors. He commented that the first page was really informative and that the pictures were really eye-catching. However, on the second page, he expressed that the amount of information in one area became overwhelming, and he began to quickly overlook things. By the time he got to the end, he questioned how to even get started finding a provider and mentioned that the information he read at the beginning had been forgotten. Although he found the brochure to be helpful, he wondered what people without insurance would do. Would they be able to use this as a resource? He brought some great perspective and suggestions that could help to elevate the project for future considerations. Healthcare is not a one-size-fits-all service, and so it would be helpful to have a unique resource tool for adults in different areas with different cultural backgrounds and different health disparities to educate them on how to best take control of their health where they are at. On Thursday, November 25th, also, 2021, I shared my capstone project intervention with my husband, Nick. Nick is a person that delayed seeking healthcare services because things seemed too complicated. And he didn't think about what he needed. He didn't know where to get started and thought if he ignored it, it might go away. During previous assessments, he stated that if he could deny that there was a problem, then he wouldn't need to deal with it, which is not an effective health maintenance strategy, as it can obviously lead to greater health complications, higher costs, and he would still be in the same position needing to find a provider and have delayed his care. He also expressed that the information was very helpful He didn't realize that there were so many ways to get started and that there were so many people involved that could help support him. He liked the information presented and learned about what options he has to get started. But really, ultimately, he wanted something more specific to him and his needs and concerns. He wanted to see specific links like resources to the Accountable Care Act or the Healthcare Exchange and specific resources that he would want to promote his health. Through that, I was able to help educate him that the tool I created was more for the adult to be able to get started and establish that treatment team that they could then be able to ask more specifics. They would know what kinds of interdisciplinary teams existed and what kinds of resources existed so that they could ask questions of their provider once that care was established and learn more about what would be specific to his health conditions, his needs, his age, and his future self-care. For him, getting started is the first step, as it is for many of us. Although he appreciated the information presented, he too mentioned grammatical errors that were distracting, and he thought that within the brochure itself there were too many sections that said, "Did you know?" made "did you know" statements. Food for thought for enhancing it for the future. On November 26, 2021, I met with both my mom and my sister. They were both very impressed with the information provided and said it was very informative. My mom made comments to you that she didn't realize that she could ask for a case manager to support her with getting the right doctors in place and is starting with a new insurance and didn't realize what tools were available through the insurance plan. Now that she has a collaborative community provider in place, she wanted to know if it was something that she could still ask for, if it was something she should ask for. And so through that, I was able to help educate her about talking with her treatment team, obtaining a nurse navigator through the doctor's office now that her care was established so that she has someone who understands her healthcare needs and can take those into consideration when making recommendations. I encouraged her to talk to her treatment team freely about the costs of her care, including for hearing aids, and that she could also use her insurance portal online to help ensure that all her providers were in network. And that was something that she hadn't considered before, as she states she trusts the recommendations of her provider. However, acknowledge that it's important to do her own research to verify and to make educated decisions for herself. She was sincerely thankful for the information, and it was a pleasure to be able to share some things that I've learned with her to help impact her life. My sister too, my sister's overall healthy and thought this project was a great resource to help get started. She wishes she knew more of this information when her father-in-law, who is from El Salvador, was in the hospital. While he was there, he's primarily Spanish speaking, and so is able to understand a little, but isn't able to take that and turn it into change and actual action once he's not in that setting. And she said that they faced so many different challenges. In the hospital, he was alone. He didn't really understand the information that was given. And when he did go home, he was discharged with instructions, but the family didn't really know what to do, how to make those something to take action on. They didn't know their next steps. And so there's gaps in care there. It creates barriers and is potential to create further health complications. Jessica, my sister, thought that through this experience and with this tool in hand, she would be able to better support her family and give them guidance so that they can get started and identify who in their treatment team can they ask for, what types of resources could they access to make his health care follow-up easier and more comprehensive. What was interesting to me um, is that I'm a nurse case manager and I work for an insurance company, and my family knows what I do, but none of them realized what case managers do and what nurse navigators do and how we can be such a pivotal part of the care team. None of them realized that they could ask for a case manager through their doctor's office or their insurance to help create a stable treatment plan for themselves. None of them realized the extent of collaboration, coordination, and support that's available out there. It was very eye-opening for me as a nurse to learn that my family had no clue what we're capable of. We as nurses are capable of. And that we're not just here to answer medical questions that they should actually be going to their doctors for. It was quite empowering for me personally to be able to share my passions, my nursing passion, with my family, and to provide them with personal information that they could take, that they could physically hold on to and reference when they needed to add a new provider, a new specialist, or make something happen for themselves through their care team, through improved team collaboration, and in obtaining resources so that they can better advocate for themselves along their healthcare journey. For me, I believe this RN to BSN journey has really helped me grow as an individual. And with each course, I've been able to share the knowledge I've gained with my husband and my family, and they've really helped to provide inspiration and encourage me along the way. And through it, we've all succeeded and we've all learned something and bettered ourselves for it. It's been a wonderful journey. In creating this capstone project, it was important for me to research what elements create a comprehensive treatment team and how do we leverage those persons and resources to create a treatment plan that best supports the quality of life and needs of our patients. It was important to understand what barriers exist within the healthcare system in regard to arranging care, communicating, and obtaining services. What are the positives and negatives of interdisciplinary communication? What have people found works well, and what has shown to not work so well? Wonder et al. 2017 says that the evidence-based practice is supported by clinical leaders and correlates to improved health outcomes and satisfaction. They say that evidence-based care is often associated with direct patient care. However, I believe that evidence-based care can also be successfully implemented from remote and telephonic approaches to provide education and support of patients at home and in the community. As a baccalaureate paired nurse, I have the knowledge to be able to seek out evidence-based resources, create change management strategies, and support implementing new policy and procedure. For me personally, I have always enjoyed education and supporting patients and my colleagues. I feel when you research these scholarly journals and you use reputable websites and learn from evidence-based information, you feel more empowered to share that knowledge with others, and that helps to promote change and success within your organization and for the people that you serve. In thinking of my capstone project, the first page of my brochure is intended to help support the adult community when needing to establish care with a provider. And it includes many ways in which a person can leverage technology to begin the process of looking for a provider online, as well as ways in which they can stay connected with their providers through healthcare portals and smartphone apps. It also identifies ways in which you can take charge of your health through email communication with your treatment team. The technology available to monitor your test results online, your automatic logging of self-monitoring results like your blood pressures and blood sugars. And you can also sign up for preventative health reminders. And I think that this information is helpful for patients to increase autonomy and independence with their health maintenance. Some things that could be considered in future practice or development of this brochure and tool would be how can adults without access to smartphones or computers stay connected with their treatment team? Perhaps for persons with hypertension or diabetes, those monitoring devices could link to their provider's offices so that their doctor has the results and information so that they can best support changes in the patient's health, and then also be able to observe for trends and identify if potential medication changes are necessary. I thought perhaps libraries that offer computers might be an option for people to access their health portals and emails if they don't have access to technology at home. And maybe like community centers or freestanding technology centers. Um, Also, additional evidence based research is going to need to be done to find the best methods for increasing access to healthcare resources online. Another area of technology that could be more explored is how to empower the older adult to learn how to utilize online resources and try to come up with a way to support them and their families. There could be classes available, maybe in-person classes or individual learning, one-to-one learning sessions. I thought that there could be written or video instructions available that they could follow as well as an alternative. Van Zalen et al. 2018 talks about how bringing technology to older adults can help improve their quality of life and decrease loneliness, depression, and anxiety. There are also assistive technologies that can encourage playing online games, finding new habits and interests, improving memory, and enhancing communication, relationships, and happiness. Those things help to improve quality of life. And some things that I hadn't considered that Van Zalen et al. 2018 discusses includes the use of technology to promote safety at home, including video monitoring, fall prevention, and recording devices, and resources for the hearing or speech impaired. Those may all help to elevate an individual's access to healthcare. To elevate this capstone project in the future, again, more research would be needed in many areas. And I think perhaps I would consider a different format in which to share the education. There's so much information that my family wanted, that the adult wants and needs, and they would like to see. And so much information I was unable to put into this 2-page brochure that perhaps a web resource of sorts could complement the brochure to expand in different areas and educate about specific needs individuals may have, with links to resources to best support the adult population and improve their quality of life. Through this, I also enjoyed learning about the Colorado State Nurse Practice Act and what responsibilities the nursing license holds, how we as baccalaureate prepared nurses can be instruments of change in policy, both within the healthcare system and the community. Ann Barry 2018 highlights the difference between the associate degree nurses and baccalaureate prepared nurses, and the difference being that the associate degree nurse is more task-oriented, focused on task-oriented outcomes, whereas the baccalaureate prepared nurse considers the holistic picture, considers outside influences and social determinants of health that may affect a patient's outcomes and overall drive higher safety and satisfaction results. Kitson et al. 2021 talks about how baccalaureate prepared nurse leaders understand the benefits of evidence-based practices and can use it to influence changes in policy and procedure, thereby enhancing quality and safety results and nurse patient satisfaction. Together, all of these things, evidence-based practices, technology, and leadership skills gained through the baccalaureate program combine to promote effective change, which promotes policy changes, procedure changes, and improves the health and well-being of our community. So I am very pleased with how this capstone project brochure came out. And it met the expectations that I did have for myself, including the information that I wanted to share to help the adult patient navigate and get started with their healthcare needs while living through a pandemic. I do believe it is a good place to start implementing best practice strategies. However, I think if it were to become a resource that would be printed and placed in community centers, doctors' offices, grocery stores, and libraries, I would want to do further research on specific demographics of different areas that it's being presented to, and perhaps conduct surveys to find out what's most important to that area, be able to focus on specific care needs, resources, websites that would help improve the region's quality of life. Again, healthcare is not a one-size-fits-all service for the whole of society. This brochure may benefit my family, specifically in the Denver, Colorado suburbs, but may not be appropriate for people living in downtown Denver, living in poverty, and from different cultural backgrounds. I believe to create a unique resource for multiple populations that increase independence and self-advocacy, it could take 6 months or more, several months, years, to provide a more comprehensive and complete tool to complete this project the way that I would want to see it fulfilled in the community, in different communities, in order to see it provide the optimal impact that it could. For me, personally, the RN to BSN program through Capella, it came at the perfect time in my life and career. I believe that I had a strong understanding of nurse leadership and how to support nurses in practice. I've always naturally been drawn to leadership roles and have almost always found myself in a position to do quality training, education for my nurses, for patients, and I do love that part of nursing. Currently, I'm a team lead and a training coordinator for telephonic case managers, and even though I felt strong in my abilities, through this program, I've really found new inspiration and a deeper understanding of what we as nurses are capable of and the magnitude of the influence and impact we can make with each other, with our patients, and within the community. I've found that through each course, it's challenged me, and I've been able to learn and then share the greater rationale of why things are done and how to create greater impact for patients, and have been able to share that with the nurses that I train and those that I work with so that they can be more successful in their roles and in their everyday patient interactions. This process has helped me grow individually, professionally, and it's allowed me to deliver higher quality care and education to the people that I work with and for. I've found that I've started to do more research. I have taken more time to evaluate all the information and the whole picture, think about the options before I move forward. Whereas before, I may have thought that I knew everything necessary and would move to make immediate change. Really, through time and research, you can affect greater change because you have the information and tools right there. I believe that the time that I've learned to take allows me to ethically distribute resources and has helped me to hold myself to a higher standard of care, a higher standard of practice. I've been a nurse for 13 years, and I truly believe it's taken this time and experience, the 13 years so far, to really understand all the ways that nurses can and should support people. I don't believe, I know that in my early career, I would not have appreciated the learning as much as I have throughout this process. And I definitely would not have had the experience gained to create a frame of reference that I do now and to be able to put it into perspective and translate it into my everyday life, my everyday work. And I absolutely appreciate it more now and have found myself more excited to work on each paper, to use my experience and the research to create papers and projects and share what I've learned, which is funny because I used to not be a big fan of school. And I have really thoroughly enjoyed this process and looked forward to the feedback and looked forward to the next project and learning. Um, and I think that that just comes with time and growth and maturity. And it came at the perfect time in my life. Um, I loved learning new ways to present information and to be challenged creatively to provide different educational tools and means for learning. Um, Presenting with stakeholders and shareholders. That's really been fun for me. And I never thought, again, I would be so excited to do research and learn and share everything that I've learned with my family, both personally and my work family. Um, I think through this also, I have better learned to be able to accept feedback. I hold myself to really, really high standards. And when I don't achieve what my goals were set for, I can really be hard on myself. And through this process, I have had to learn more perseverance and tenacity. I've also had to learn how to make sure I take time for me and put more self care in there so that I can be better for myself and for others. And through this, I am so proud of where I've come as a nurse and as a person and the growth that I can see in myself, the excitement that I have to move forward and implement what I've learned into my everyday, like whether it's my family or the community or my patients. I really look forward to being able to use all that I've gained to help make healthcare change in the future. Um, and I really appreciate this time. I really appreciate everything that Capella has had to offer, the teachers, the feedback, and the experience. So, thank you for that. And with that, that completes my presentation. Um, Thank you for your time. I hope you have a wonderful day.